saying thank you very much for joining us. With it being now 1 o'clock Eastern for the presentation today, I want to make sure that everyone gets connected via their computer with both the screen as well with the audio before we begin. So with it being on time to start, for those of you who have joined, just give us about 2 or 3 more minutes and we'll go ahead and begin the presentation. Thank you. My name is Tim Hygis, and I'm the Vice President of Discovery Innovation for medical libraries here in the United States and in Canada. And today we want to talk with you about our new store that's available to all EDS customers worldwide and EDS Discovery Health customers worldwide. It's the EBSCO Health App Store. And in designing this, one of the things that we really wanted to do was help not only libraries and hospitals that are currently using EDS Discovery Health, but also for those libraries that maybe you're a small critical access library and you've got 23 beds at your hospital and you're thinking about discovery, but you haven't made the move to purchase a discovery system yet. And you see that and you think, oh no, I'm kind of reticent to make the move into discovery because I don't have the internal staff time, I don't have the IT department time to really begin to implement a service altogether and then really make it my own. This Health App Store allows you as that librarian at a critical access hospital, maybe as a large hospital system, or maybe as you're an IT professional and you want to be able to get those apps that enhance the user's experience and enhance the library's interface that go beyond requiring that custom code, which means you're going to have to work on these features that enhance that experience. This App Store that we're going to share with you today allows you to be able to get in and get the stuff that you need to customize the experience, to take it away from being a discovery branded experience and into a true overall experience for you as a hospital, you as a library, or you as any information gateway from the content that you hold into all of your researchers there whom which you serve. And so in talking about the service altogether, when we talk about EDS Discovery Health, we understand that libraries have different ideas of what discovery is. But really, with EDS Discovery Health, it's the only one on the market today that has created a discovery experience specifically for medical researchers. And when we talk about discovery in presentations to individual libraries, to hospital systems, to medical universities, we say here are the 6 tenets which separate EDS Discovery Health from any other discovery service on the market today. And we go through these, and these are part of a larger PowerPoint presentation where we share everything about discovery for a library. But these 6 tenets always get questions on these points right here. Number 1, quick access to all the resources in the medical library. Number 3, increased visibility and usage of your library's resources. And number 4, integration with an existing intranet, an EMR, or even policies and procedures there at a hospital. And invariably, and I've been with EBSCO for, well, next week it'll be 18 years, and invariably there's a question on number 1 when all the resources are mentioned. Because there is no discovery service on the market today, including EDS Discovery Health, that indexes everything that is available to a hospital or even a library for that matter. So the hand goes up and it says, well, wait a minute, Tim, if you've told us that you don't index everything that we have access to, I mean, you've got the largest knowledge base of any discovery service provider we're looking at, 26,000 publishers' content, but it's not everything. How do you say all? Well, that's what I want to share with you today, is by having that all and that differentiation between everything and bringing it into the library. We also want to make sure with point number 3 and increasing that visibility of usage of your library's resources. Invariably, you have links out to maybe state statutes. Maybe you have links out to open access content in another state or in another province. How do we bring that content into the library? And then even incorporating things like your intranet, maybe an EMR, maybe the hospital has a discharge policy, or maybe any sort of policies and procedures that you want to highlight inside of your discovery experience. Because when you purchase a discovery service, and with EDS Discovery Health, it is no longer an EBSCO experience. It is an experience that is branded the library, or branded the hospital, or branded the university library, so that as a marketing arm of the larger hospital or of that larger university, you are now providing a virtual front door for all of that information, and this Discovery Health App Store allows you to do all the points here in this slide, as well as within the highlighted slides as well. So the question then comes up, well, okay, you've told us that you can have all the resources in the library, but how do we integrate content that's not necessarily in your knowledge base or not necessarily in part of your base index? You know, we have a great network of partner libraries worldwide. There are about 9,000 libraries worldwide accessing EBSCO Discovery Service, and of those, probably about 900 accessing EDS Discovery Health. And there are any number of variations on what the user interface can look like. And we've had success with a lot of library partners incorporating our content that isn't necessarily A, in the index, or B, even makes sense to be in an index, or E, or B, in a knowledge base, because it doesn't have traditional content. So what we've seen here, a very successful library using EDS Discovery Health, AT Still University, College of Osteopathic Medicine out in Phoenix with campuses in Missouri as well. They've created a discovery service that is truly their own by incorporating all of their publisher content inside of their base index, but content that doesn't have traditional indexing and abstracting, but content that makes sense to that research experience. They've created these apps here that bring in non-partner, non-licensed content inside of the base index so that it complements the whole experience for their researchers, be them undergrads, be them graduates, be them faculty members, be them any part of the staff, incorporating all of that. So I want to share with you today how you can create a discovery service experience via EDS Discovery Health, and now with this Discovery Health App Store, allow you to truly brand it your own. And so in prepping for this presentation, I was, probably November, December of 2015, I was catching up on health management technology, and arguably a little behind. This was published in 2013. But Jared Blankenship wrote about this, and he wrote about integrating all sorts of different content types inside of a library or inside of a hospital's IT department. And he brought up a great point. He says, when internal information systems lack interoperability, clinicians do not have access to the permanent information. If this information is not readily available, mistakes can be made that put patients at risk. If you've got a discovery experience that is excluding content or excluding pieces that are central to saving lives, to patients, to furthering research at your institution, then it's counterintuitive to what a discovery service is supposed to be all about. That's where we take a different philosophy, and not only EDS Discovery Health, but also with the inclusion of this App Store, to ensure that irrespective of where this content is coming from. And irrespective of what pieces of content you want to put inside of your discovery experience, we can ensure by complementing that knowledge base with the apps, we can ensure that that content is there for your researchers. There was a relatively recent survey, so 2014, that came out of from nurses nationwide, and it was taken by the Gary and Mary West Health Institute, and they found that 60% of registered nurses say medical errors could significantly decrease if hospital medical services were interoperable. 74% of those agreed that it's burdensome to coordinate that data, and 93% agreed that they should be able to share that data seamlessly. We firmly believe that the West Health Institute had it right on with those findings. As a discovery service provider, we need to ensure that your content is accessible, because you could be the librarian and you could be getting a phone call at 1 a.m. in the morning, and on the other line is that doctor who's sitting there in the operating room and needs that vital information. If you've got content outside of that, if it's not interoperable, then you're missing the experience altogether. We can alleviate that. I mean, if you think about it from the cost perspective too, even with the West Health Institute, they estimate that at about having a connected, fully interoperable health system could really have the potential of costing a hospital system about $30 billion per year as a nation. So thinking about the cost that the West Health Institute seeing, really this app store is going to be able to help alleviate all of that. So when we talk apps, when we're talking about presentations and we're talking with our library partners and with potential customers of EDS Discovery Health, they say, now we think of an app like this. So the apps that are sitting on the phone, or you used to call them widgets. Well, yes, they're kind of a little of both, but the apps really that we're talking about today are not necessarily these right here, but they're more of an experience for all of the discovery service access, whether it is via your computer or it is via your phone, because we will transfer that over to the mobile experience. So that's where we introduce the EDS Discovery Health App Store. And it's a browsable website for all apps, for any placards, any plugins, any extensions, things that you want to create to make that discovery service your own as a library, as a hospital, as a university. And so today what I want to do is kind of share with you some of the apps that are available, being able to implement them, creating this community that you have with your researchers so that your user interface is no longer an EBSCO branded interface or a Wiley or a Springer or an Access Medicine branded interface. It is all branded your library or your hospital. This helps accomplish that altogether. There's about 50+ apps that are available specifically towards the medical market. But if we look at the larger apps that are available, there's nearly 100+ apps and growing, because we have this network of engineers who are constantly listening to our library partners and asking them what they need from us as a discovery vendor. And those library partners are asking us, where is the best way to put an app? Do we put it on the result list? Do we put it on the full record itself? Do we put it on the search screen? And that's the great thing about the EDS Discovery Health App Store, is that you can do all three if you want. You can create an app for the result list, as I'll show you in just a moment. Or maybe you want to put it right on the initial search screen experience. So when I, as a researcher, come into the library and I see a simple search box that creates that gateway to all of your information. Maybe there are specific things that I'm just looking for as a researcher. Maybe I just want my ebooks. Maybe I just want ebooks on something that's topical, like, for example, the Zika virus. As a hospital and as a library, you can create an app that has just those specific ebooks that are created right there on the search screen. Or maybe you want to put it on the full record itself. So once I've seen it, once I've seen the citation on the result list and I've clicked into the actual record itself, maybe I want to go in there and see other recommended books or books that are also written by this particular author, or maybe even citations from this author as well. We can create that on the full record page so that I, as the researcher, don't have to leave to get my metrics from Plum or, say, Google Books or things like that. So we've had this great network and this app store that really we've created with our user community, but we couple that with the 30-plus worldwide discovery service engineers who are working with our partner libraries to create these apps. We've created them in a number of different categories, but we've even seen some abstract things that are genius, that are created by the library, but using the technology behind the App Store. We've got some libraries that do it for anticipating the user intent. So maybe I have done a search on phrenic nerve damage, and I've gotten 84,000 results. What a library can do is, over a threshold of any number, they can create an app that says, did you see too many? Did you see too many results? Or even, did you, in contrast, did you see too few? And incorporate a video of how to manipulate the result list to narrow it down, or even to expand it out, even to highlight content. And that's one of the things I'm really going to focus on today, is bringing in things like a DinahMed Plus or a clinical key, or even mesh headings if you want to incorporate those as well. I'm going to show you not necessarily how to do it, but how to get to the App Store and what this means to you as an experience altogether. And even library and hospital interaction. So maybe something for SurveyMonkey, or we've seen Yelp reviews incorporated as an app for a hospital. One of the unique fun things that we've seen, and this was in a traditional academic library, is that there is a library in Oxford, Mississippi, and the only Starbucks that exists is in the lobby of the library. Now, that Starbucks happens to be the only one between Jackson, Mississippi, which is 2 hours away, and Memphis, Tennessee, which is 2 hours away. What the brilliant librarians did there is that they had their discovery experience tap in to a camera that shot on the line of the Starbucks, so that I can do my research for the University of Mississippi Library and monitor the length of that particular line. Now, you could do the same there at your hospital. Maybe you have a cafe, or maybe you even have a security camera for your front door. As long as you're not violating, of course, any security codes, that is the potential behind this app store of you to make this experience 100% yours. So I want to begin by kind of showing you some of the apps that are available and what the potential is that you can do with these. All of the code has been written by our discovery service engineers. You can easily access this content via a URL that I'm going to share with you in a moment. And then this has the potential of you in 20 or 30 minutes sitting down and creating a discovery service experience that is 100% yours. We also, if you don't want to do anything with your discovery service experience, but make it your own, we have a team of what's called professional services that can come in and incorporate a book carousel, for example, and you don't have to worry about anything other than saying, yes, we want EDS Discovery Health. we'll take it all from there. If, in contrast, you wanted to customize it all of yourself, this is what the App Store is designed for. So creating a book carousel, the idea is that you've got all of this content inside of your knowledge base. So there's journal content, there's catalog content, there's ebooks, there's policies and procedures. How our users want ebooks. So how do we highlight either new ebooks that are available, or even maybe ebooks that cover a particular subject that's really tailored for this particular hospital? So one of the things that we've done is created this book carousel that you can include right onto the result list page. And this would be, if this were an animated slideshow, you could see that this carousel ends up turning on the most popular books or the top books in your collection that you've selected via EBSCO admin, which is the administrative module, and it allows that end user to see that interaction of the ebook that are placed on there. You can create it on the result list, or we've had some libraries created here. So on the initial search screen, with having that rotating carousel of new ebooks, or maybe even ebooks that are specific towards something that's pertinent going on in the city, creating it there so that that end user can go right into a book on health policy issues, click on that, maybe I'm a visual learner, and I get a result list that gives me just the table of contents for that particular book. It's been really, really beneficial because not only does it take a library's website and incorporate all of the content to which a library has access, but the visualness of creating interest for that research experience with that book carousel allows that end user to be drawn more towards the book covers on pediatric heart failure or on health policy and getting right into those books. This is another thing. I was talking with a library out in Santa Clara just yesterday, and they wanted to look at EDS Discovery Health, and their question was, well, what if someone comes to me as a researcher and they've got a PubMed citation and there's all of these field codes in there and this long string of citation, how am I able to fish through all of this content that's inside of the knowledge base and bring back just that individual citation? So with the Citation Resolver app, incorporating it, it allows you to take that citation, or maybe you've got something, maybe it's an APA citation, or maybe it's an AMA citation, or maybe it's coming from Chicago to Arabia. You can take that exact citation with this app and plug it into the search box up at the top, and it doesn't yield everything that deals with all of those terms. It knows intuitively that that researcher wants access to this individual article. It's found somewhere inside of your knowledge base. They know you have it. You know you have it. Why not, if we can make it available to you and to that end user, why not make it easy and not have 84,000 results come back, but just that one result right there so they can get access to the research immediately. We come to also something called the Item Exact Match Recommender. What this does is that we look at our search logs and we find that end users don't necessarily type in Boolean operator search terms. They ask it questions. What are the library hours? What Medline, Web of Science, things like that. And we find that if we had traditionally done search, so if you look at EBSCO host altogether, we're in 185,000 libraries worldwide. So those databases are used in nearly 200,000 libraries. You look at our search logs and you find that as we've evolved with time, end users are going in and they're typing in things like Web of Science, not understanding that traditionally those were stop words, or those were words that were found in nearly every article ever published. You don't want articles that come back on Web of Science or on Medline. You want the database. So with this item exact match recommender, you can go into that search box and type in things like Web of Science or what are the library hours, and not bring back articles on library and hours or Medline, but in the placard area, which is the top of the result list, bring back the actual database itself. We've even, with the benefit of having what's called Full Text Finder, which is our link resolver and our A to Z list, now we find that when I come into a search box as a researcher and I type in JAMA, or I type in J-viral, or I type in PNAS, I don't want words that are, that have JAMA as a term inside of them. I don't want nonsensical words like J and viral, or an acronym like PNAS. I want the Proceedings of the National Academy of Sciences of the United States of America with the item exact match recommender. And because you couple it with Full Text Finder that you get along with EDS Discovery Health, those researchers who type in JAMA are not going to get nonsensical words that come back or acronyms that come back inside of bodies of articles. They want your journal, and they want your full run of the journal altogether. And so we've gone actually one better with that, is once we get your the full run of your journals via Full Text Finder, as a researcher I type in JAMA, not only do you get your full run of JAMA that is right there in that placard area, but you can search within the publication altogether. So if you wanted to search phrenic nerve damage inside of everything that your library holds for JAMA, it's going to repaint that result list and bring back everything dealing with phrenic nerve damage inside of the full run of all of your journals. And then, as I mentioned, we had put in the journal short names as well, so that if you put in J-viral or PNAS, you're getting everything back for those particular journals. This has been a really popular one as well. It's the link list with button logos. Medical libraries and their researchers are highly visible. Again, looking at our search logs from all of our markets, so medical libraries and academic libraries and public and school, we find that the majority of visual learners come from medical and academic researchers. So by incorporating this link list and the button logos, now we're able to take this search experience all together and draw that eye for those visual learners, or really for any of our end users. Draw that eye to the right side of the screen, which in the West, it's harder for us to look on the right-hand side of the screen, but draw it over for all of those medical sources that may not be traditionally indexed and abstracted inside of the knowledge base altogether. So things like, UpToDate, PubMed, Clinical Key, which are not EBSCO services, but don't have traditional indexing and abstracting, but even for traditional EBSCO services. So if you have like a DinahMed Plus or a Nursing Reference Center Plus, they don't have traditional indexing and abstracting, so they don't necessarily make sense to be incorporated inside of a linear result list, because point-of-care information might get lost in the overall result list because it doesn't have that traditional indexing and abstracting. But we make it available, and we simultaneously run this search of spinal injury against the DinahMeds and the UpToDates and the other things that you have customized you want listed over there, and bring back past that end user through to that particular database. And all I do is I click on DinahMed or I click on UpToDate, and it spawns the results for that particular resource on your search. So the benefit there is to not only make the result list attractive but also interoperable so that the researcher misses nothing altogether on the resources that you're providing for your end users. This is a great thing that we were able to put together in the last week. As many of you have probably heard, the National Library of Medicine just last Friday, maybe even Saturday, announced MedPix, which is a free online medical image database. What we've done over the last course of the last 6 or 7 days is our engineers got working on this steadily so that we're able to create a button logo for MedPix so that if you wanted to go ahead and employ it over the last 6 days and you want to incorporate it inside of your EDS Discovery Health, now with the link list button logo that's available through the App Store, there's access to MedPix. And so with this search, which is ulcerative colitis, now you click on this and the MedPix comes back from the National Library of Medicine and brings back those results from this brand new database. SharePoint, or really any contact management system that your hospital is using, we can create a search box inside of SharePoint. I meet with librarians all the time that say, we have SharePoint, does EDS Discovery Health work with SharePoint? And it absolutely does. So you're inside, and maybe your researchers and the staff and administration at your hospital are accustomed to looking for records and internal hospital content, but maybe the library's content has been traditionally independent of that. With EDS Discovery Health and with this search box for SharePoint app that we make available, now you can incorporate this inside of your SharePoint experience altogether. And so I, as an administrator or as a staff member, or maybe I'm a team and I'm working on a research for a patient, and there's the nurse on the team, and there's a physician on the team, and the librarian's on the team, and I'm just one person of this team, and I want to be able to continue the experience inside of SharePoint and then push it out to all of my team members. This way, the researcher, the team, the individual on that team doesn't have to leave the SharePoint experience at all, and bring that library content to that end user. And for those libraries who are also using DinahMed or DinahMed Plus, as I mentioned a couple of minutes ago, it doesn't have traditional indexing and abstracting. So we want to make sure to incorporate all the resources that are included at the library. And if you've got a DinahMed or any sort of point of care reference, so if you've Nursing Reference Center Plus or Rehabilitation Reference Center, or even like Clinical Key or things like that, Web of Science, these placards can be created for you as a library to ensure that they get access to this. So DinahMed, having the access to this evidence-based content, having access to this point of care content, maybe I come into this library search box and I search DinahMed as a term. We don't want results to come back that mention DinahMed in articles. We want the actual database itself. Or maybe you have made DinahMed as your individual point of care resource for everything evidence-based that your hospital provides. But you've also got complementary content coming from all these different publishers that you want to highlight as well. There's no reason at all that we shouldn't be able to provide any sort of point of care resource or any sort of data set in this placard area so that your end users are able to get to it by searching stroke recovery or by searching a term DinahMed. We can put this right here in the placard area and highlight it so that your end users know that I can go right to that, making the virtual front door of your library open for everything on the research side as well as on the approachable researcher side. And then we just released one within the last couple of weeks for DinahMed Plus. So if you purchase DinahMed Plus, now you can create this inside of your EDS Discovery Health app placard area, and we do it via our API, and you're able to put that there, similar to what we saw with DinahMed, similar to what we can do with a Web of Science, similar to what we can do with library hours, having it front and center so that if I'm searching thyroid disease and I want to go into follicular thyroid cancer, I can go right into that result from DinahMed Plus. It passes that researcher through so that I'm able to yield those results inside of there and get my point-of-care evidence-based content. So as we mentioned at the top of the presentation, there are about 50 apps that are currently available. So there's apps for listed here. There's the mobile EDS. There's a SlideShare app. There's Save PDFs. There's a Google Analytics app. There's a Google Books app. There's a Java sample app. So any number of different apps that are now available, we want you really to decide how you're able to get to the content, make it easy for you, and customize that front end for your library, making it seamless, making it yours, making it completely interoperable with not only the traditional indexing and abstracting, journals, catalogs, books, content like that, but also ensuring that this virtual front door of your library has been redefined by incorporating EDS Discovery Health as well as pulling content from the App Store that has already been pre-developed. This is your decision to really reinvigorate your library if you're an EDS Discovery Health customer, or even if you're thinking about becoming one. And it's all available right now at discoveryhealthapps.com. You can go to it right now. You can get information about the apps, and then from there, if you're interested in a particular app, if you don't have access to the store right now, we just ask you to fill out information, and we will provide the coding for you. So that wraps up the presentation on the Discovery Health App Store. I've seen that there are some questions that have come in, and in the chat box in the bottom right-hand corner, and on the line as well is our Discovery Service marketing guru, Rachel Freeman, who will help me kind of coordinate some of the questions that have come in. Thank you all.
Thank you, Tim, for your presentation, and we do indeed have some questions coming in. The first one is from Kathy, and she asks, will staff be able to earn CEUs as they normally would through DinahMed or UpToDate?
Hi, Kathy. Thank you very much for the question. Thank you, Rachel, for translating that. I did lose you in the first part of it, so I must apologize if you could re-ask the question. It had something to do with CEUs.
Exactly. No problem. She asks, will staff be able to earn CEUs as they normally would through DinahMed Plus or UpToDate?
Absolutely. Absolutely. So because what we do with this is we pass you right through it, there should be no discrepancies whatsoever in being able to get to those CEUs and earn them through there.
Excellent. That's all I see for questions so far, unless we wait a couple minutes to see if anyone else has any more.
While we might be waiting, I might do a plug for our EBSCO Discovery Service user group. It's coming up in the first part of May, so it's May 10th and 11th, and it's open for all EBSCO Discovery Service customers. If you're part of our EDS listserv, you may have seen the announcement of this a few weeks ago. It's in Boston, a lovely time to be in Boston, and it's sponsored by the American Psychological Association in the IT. And the idea behind this is it's not a sales presentation. It is not a service presentation. It is a true user community where there is back and forth between all of our customers worldwide, as well as some of our engineers and developers. We're going to cover things like relevance ranking and interoperability and managing your e-resources and user research and collection management and APIs and apps and all sorts of things like that. So if you're a current EBSCO Discovery Service or EDS Discovery Health customer, feel free to register at www.ebscousergroup.org, and we would love to have you come to Boston and be a part of this first ever EBSCO Discovery Service user group.
Thanks, Tim. I don't see any more questions coming in through the chat box or the Q&A box now, so we can go ahead and I'll leave it to you, Tim, to wrap up.
Okay. Well, on behalf of everyone at EBSCO and involved with EDS Discovery Health, thank you very much for attending today. Thank you very much for your business. And at any time, you feel free to contact me at my information right here. If you have any further questions, I look forward to meeting you and talking with you further at MLA in Toronto and at the EBSCO, the EDS user group meeting in a couple of months. So thank you very much, and I hope you all have a wonderful weekend.